Hello. Well, welcome to part 2 of the Toxins in Cancer webinars. And in this one, we're really going to talk to you about effective detoxification. Now that you know all the potential sources of toxins in your environment, there really is something that can be done about it. And I'm going to start off by recapping a little bit about what we talked about on Tuesday, and also in case some of you missed the webinar on Tuesday. First of all, the cancer statistics. Now, these are all numbers and figures and conclusions from the President's Cancer Panel report that came out in April of this year. And the sobering statistics are that 41% of Americans will be diagnosed with cancer at some point in their lives, and about 21% will die from cancer. The prediction for 2018 is that the lifetime risk of cancer will be 50%. And a great deal of these cancers are caused by hormone interrupters, which are present in our environment in the way of chemicals. Now, the President's Cancer Panel concluded that the true burden of environmentally induced cancers has been grossly underestimated, and that's their words. So whereas 20 and 30 years ago, they were really into what I call blaming the victim. Well, it's your genetics, it's what you eat, you're too fat. Now they're coming around and saying that the true burden of environmentally induced cancer has been grossly underestimated. Now, environmentally induced means caused by something in the environment. In fact, the figure in some assessments, especially for the hormone-related cancers, is that it can be up to 90% of hormone-related cancers being environmentally caused. And those are some of the most common cancers, specifically breast cancer, ovarian cancer, and prostate cancer. So what we try to look at when we do a toxic inventory on an individual is what is the body burden of toxins. And this can be from repeated low-level exposures over the course of decades, of a whole lifetime. And there can be unknown mixtures in there. In other words, we are exposed to a lot of things where each individual component might not really be all that toxic, but when received together with other things in the mix may provoke a degeneration or a chemical reaction into something that's significantly more toxic. In fact, more is unknown than is known about what's the effect of toxic combinations. Also, we see that multiple organs can be affected, and some to varying degrees. Not only are organs affected, but body systems are affected, such as the immune system, the digestive system, the neuroendocrine system. So we have organs such as brain and liver and kidney and reproductive organs being affected. Then we have these body systems that are supposed to regulate our immunity and our hormones, and the whole systems are being affected by environmental toxins. The other thing that happens is toxic effects can become amplified because there is something to cumulative exposures. So let's say somebody who works in a nail salon is exposed to solvents on a low level, but every single day, or at least 5 days out of the week for several years. So we see toxins being amplified because of the cumulative exposures. Also, they can be additive. One toxin in one area, in the amount that you get exposed to it, again, might not be all that toxic, but when you add it to a toxin from another source, the two together can become toxic because of the additive effect. And then we also see synergistic effects, again, where one substance may be relatively inert or inactive, but when it is combined with something else that activates it, degenerates it, decomposes it, then we have what we call a synergistic effect, and we see more toxic effects than either component alone. And the problem with detecting the toxic body burden is that usual tests that we do not actually assess what is our toxic burden, and that's why we rely to a great extent on indirect tests, but also on the toxic exposure history. So we went over this a little bit on Tuesday as well. Where are toxins in the body? Well, they can be in the bone, they can be in the brain, they can really be in any organ, they can be in the blood, although the blood works really hard. The systems in the body, the filtering systems, work very hard to keep toxins out of the blood. They may only be in the blood transiently, just temporarily, and then they go to reside in bone or brain or other organs. But one place that we know a lot of toxins are, especially the so-called organic chemicals, the things that are derived from petrochemicals and plastic production, is in the fat, specifically the fat that is around the organs. So again, I said that the usual tests don't really pick up how, the total body burden of toxins, and all we're doing is sort of estimating it. Different substances are better detected in the blood on the surface of red blood cells. Some substances are better detected in the urine. Hair tests can be an effective way to test for certain metals. But none of these things show toxin and the toxic burden in the fat, and that is really only obtained by a fat biopsy. And so obviously this is not a test we're going to be doing on a regular basis in our offices. Now, PCBs, we've heard about these. This is a very, very toxic anti-hormone interrupter, and it resides in fat based on biopsy studies at levels that are 10 to 120 times higher than what we find in a blood test. So again, the blood test is a very poor indicator of the body burden. And look at that wide range there, anywhere from 10x up to 120x. So just based on your own blood test, we don't know, and that's a factor of tenfold there difference as to, well, if that's your blood level, what is your fat level? It's something we're only going to find out by a fat biopsy. Chlorinated pesticides have been found in fat 300 up to 1,000 times higher compared to what we see them in blood levels. So when somebody gets a blood toxic analysis and they see very low levels, that is nothing to be comfortable about. It's just not a good indicator. And most serum levels of the usual organic toxins that we're looking at, and organic meaning contains carbon, whether it's from pesticides or plastics or chlorinated byproducts, they were below the limit of detection in blood. In other words, as low as the machines will go to detect, they couldn't find anything in blood with the exception of DDE, which is a degenerated product from the pesticide DDT. Everything else was undetectable in blood, but we could find it in the fat. Now, effective detoxification actually works on the fat and releases toxins from the fat. And I want to clarify the term I'm using here. Detoxification is the process by which the poisons and toxic qualities of various substances are reduced by, and in the case of this program I'm talking to you about, by actually getting to where they reside in the fat. And you see a lot of terms that are sort of used as synonyms with detoxification, and they're not necessarily the same. We hear and we see advertised on the internet and at various health clinics the idea of a cleanse. And a cleanse is usually something that's very light, very superficial, maybe specific to a certain organ. A cleanse for kidney stones, a cleanse for gallbladder problems, or a liver cleanse, or a blood cleanse. And these things are not, strictly speaking, a detoxification. Decontamination is another term that's sometimes confused with detoxification. That's basically a washing off of exposure, whether it's a chemical exposure, or there's even a decontamination that people go through literally with water, washing off after they've had an intense radiation exposure. So it's only removing what's easily can be washed away. You've heard of various flushes, and sometimes also called cleanses or detox, and these are usually very brief programs to address general liver health. And they're not really what we mean by detoxification. Purges, of course, can be done either by promoting emesis or vomiting, or purges out the other direction through the bowels. And this can definitely get rid of a lot of stuff, but it's not what we're talking about with detoxification. A closer word would be to purify, would be closest to what we're talking about with detoxification with this program. So let's talk a little bit about sauna detox and what's the history of it. And this is an amazing quote I came across from the father of medicine, the earliest known literature in the Western world on medicine, from Hippocrates. And this is a quote attributed to Hippocrates: "Give me a chance to create sweat and I will cure disease." That's amazing, and it tells you how long sauna has been in use as a therapeutic detoxification. So we look at sweat. It's actually the earliest known form of detoxification. It's been used in traditional cultures of all kinds, and in this country we are more familiar with the Native American detoxification. But you know, you've heard of Finnish saunas; those go way back. Russian, the whole Baltic area had their own versions of steam baths or dry saunas. Pre-Christian Ireland was big on saunas as well. In Africa you find saunas in various cultures. Greece, of course, the quote from Hippocrates is a testament to how that was used in Greece. And then the famous Turkish baths were essentially saunas. And the Roman baths and the Japanese in ancient times had their own version of a sauna. Now, the Finnish word for sauna is very interesting, loili, not sure how that's pronounced, but it's very interesting because it originally meant spirit or life. And I find this interesting because usually when people go through this deep cleansing detoxification sauna that I'm going to be talking to you about, aside from whatever physical benefits they may get, one for one they remark on the actual changes in their life, and they get a sense of a new lease on life, new hope for life, rejuvenation, just re-energizing of themselves spiritually, a much greater interest in other people and less of an introversion. So there's something about an intense sauna program that really does affect the spirit. Let's talk specifically now about the components of the sauna detox program that I recommend, and this is administered by SaunaPure. It combines a traditional sweat program, which has thousands of years of experience of being effective, with modern day science in the form of niacin, exercise, pure oils, specific vitamins and minerals, and also real important components are supportive nutrition and, of course, just common sense, adequate sleep, and water. This program was developed by L. Ron Hubbard, and you can read about it in the book Clear Body, Clear Mind. It's a book you can get at Amazon.com, or you can go to Barnes & Noble and Borders, and this book is also available there. So the detox as administered by SaunaPure involves sauna temperatures of 140 up to 180. Usually they don't really get up above 170. And these are slightly lower temperatures than what you would normally find in a health club because the people are in the sauna for much longer periods. The total amount of sauna time is anywhere from 2.5 up to 5 hours. Now, lest you worry about, oh my God, you would just turn into a prune in there in the sauna, that is not all in one stretch. People are taking frequent breaks to cool off in a shower, to grab food and water and minerals as needed. So the max would be 5 hours in any given day. And it is a daily program that is done every single day until completion. Now, the reason this program really works on the fat is because of this component of niacin. Niacin was discovered in 1955. You may also know it as vitamin B3 or as nicotinic acid, but don't get it confused with nicotinamide. Nicotinamide is a modified niacin molecule that does not have the same effect on fat that niacin, also known as nicotinic acid, has. So nicotinamide is not the same. It was the very first cholesterol-lowering drug and is still used today and lowers cholesterol at least as effective as the best-selling drug in the world, Lipitor, and sometimes better. Niacin is an essential component of NAD, and for you biochemistry fans out there, NAD is a molecule that's intimately involved with the body's energy production unit deep in the cell, in the mitochondria. And mitochondria is really the energy production component of the cells. And NAD is involved in the final reactions to convert whatever we eat, fat, carbohydrates, or proteins, into energy. And without niacin, there is no NAD. So these substances, niacin and NAD, regulate the repair of our genetic breaks. So our DNA, our chromosomes, get broken by everyday metabolism, everyday living, products of our own metabolism, but also by toxins from the environment. And so this substance regulates the repair of our chromosomal material. It also regulates the liver detox pathways. So to have a detox program that heavily involves niacin is really tremendously supporting the liver in its natural role as a detoxifier. Niacin and NAD are required for the transformation of foreign compounds so that they can be eliminated. So you ingest or get exposed somehow, absorb through your skin, inhale a foreign substance, and NAD and niacin are required in order to biotransform it so it can be eliminated through the bowels or through sweat, through breathing out, or through the urine. And this NAD actually comes from niacin. Now the interesting thing about niacin too is it regenerates glutathione. Just a side note here, glutathione is the body's #1 detoxification molecule. So why isn't everybody on glutathione? We find that if you take glutathione orally or any other way we've tried to give it, that it doesn't really get absorbed. The body's got to really make its own glutathione from precursors. And glutathione is a major detoxifier all throughout the body, but especially in the brain. And we're not only worried about hormone interrupters in the environment causing cancers, but we're worried about things in the environment that are little by little knocking away our brain function. As our population ages, we're seeing a great deal more of dementia, and whether it's actually Alzheimer's dementia or just old age senility. And the leading theory on that is that it's accumulation of little micro insults to the brain not being able to handle toxins, whether that's from the aluminum in our deodorants or whether it's from being exposed to all the plastic we're exposed to from drinking from plastic bottles all the years, microwaving, etc. So glutathione is very, very essential for the body, and niacin regenerates glutathione. It regenerates up to 80% of the body's own glutathione. Just by taking niacin, you can really promote your body's natural detoxifier. Niacin in animal studies has been shown to prevent cancers that are caused by light rays, and by radiation of various kinds, whether that's in the visible spectrum or not, and also can prevent the immune suppression that happens from various types of radiation. That's why one of the things that we see as a result of this program with the doses of niacin that's used is universally people say my skin has improved, which is very important in terms of preventing the onset of skin cancers. Now niacin also has been found to reverse the hardening of the arteries. It used to be thought that once you had this plaque on your arteries, that was it, but not only does niacin lower cholesterol, but by a whole different mechanism it's found to reverse the hardening of the arteries. And it does that in part by inhibiting clotting factors. So if somebody is prone to blood clots or already has hardening of the arteries or has already had some heart problem, taking a good dose of niacin can not only reverse the hardening of the arteries but inhibit future clotting without making the blood thin. That's the great thing about it. It's not like taking a blood thinner where you have to worry about bleeding when you're shaving. Now another component of the program involves pure oils. And that's because we find that when you're trying to take something away from the body, such as toxic fat, the body will actually hold onto it unless it gets something to replace that fat. So you really have to give it some so-called good fat to replace the bad fat. And that's the philosophy behind giving pure oils, and we find it's very, very effective. So along with gradiently increasing doses of niacin and increasing duration in the sauna in this program, we add increasing doses of pure oils. These are organic cold-pressed oils, and it's the 4 oils you see listed: peanut, soy, walnut, and safflower. But these can be substituted if somebody happens to be allergic or if somebody has some reason they don't want to take soy. Now I know that soy at one time was touted as the health food oil, and in recent years it's gotten more of a bad rap. But a lot of that bad rap from soy has come from the fact that people have been using highly processed soy oil that was not organic and was not cold pressed. On the other hand, some people are allergic to soy, so if somebody has a sensitivity to peanut, soy, or anything else in this mixture, we can substitute other oils as long as they are organic and cold pressed and polyunsaturated. Now we do find that some people also need the addition of evening primrose oil, and that's on an as-needed basis depending on how they're doing in the sauna. There's vitamins that go along with this program. As we gradiently increase the dose of niacin, we have to increase the supportive vitamins, because it's found that as the body uses the niacin and actually puts it to work in the detoxification process, it sort of consumes the other vitamins. So there is a need for gradient increases in vitamin A and B complex, and then in addition to that, some extra B1. There's a need for increasing doses of vitamin C and D and E as well, and these are given on a very specific schedule. Minerals are a very important part of the program, particularly the macro minerals, in other words, those minerals that we need in large doses, calcium and magnesium. And this is given in a solution, so powder is dissolved in water and in a slightly acidic solution, so that the calcium and magnesium actually go into solution and can be immediately absorbed into the body, unlike a tablet. Which a lot of those tablets actually come out the other end completely intact without any absorption. And when we put it in solution, we can be assured that the person is actually getting everything we're giving them. And this is given in a specific formula in a 2-to-1 ratio of twice the amount of calcium to magnesium. Then we also have the people take some trace minerals. Rarely someone has to take some trace minerals that doesn't include iron in case they have a certain medical condition. But most people need the whole gamut of the trace minerals. What a person does is they take the niacin, which causes a tremendous flushing of the skin, and this is dilation of the blood vessels out on the skin. Some people if they don't expect it, they feel like they must be allergic to it, because it looks for all the world like you just had an allergy to shellfish or peanuts or something like that. But it's transient. It only lasts anywhere from 20 to 45 minutes. And that's what we want. We want the niacin flush. We don't want the no flush niacin that's sold over the counter at health food stores. That does not have the therapeutic benefit that we're looking for in this program. After the niacin is taken, we have the participants do moderate exercise for 20 to 30 minutes. And this usually involves running on a treadmill or jogging around the neighborhood. And this really gets that niacin in circulation and gets the dilation of the blood vessels really going at the full peak. It does not lower the blood pressure. It does not affect the dynamics of heart function or anything like that. Other components of the program are, it's very important to get adequate sleep during the program, and it's very important to eat really good food, and particularly we find that quality proteins are really necessary during this program. So I don't know if any of you have heard of the New York Rescue Workers Detoxification Project, but the workers who responded, the rescue workers at Ground Zero on 9/11 at the World Trade Center disaster, themselves were very much exposed to toxins. And those workers, about 1,000 of them to date, have gotten this exact program. And it's called the New York Rescue Workers Detox Program, and I've just listed a few medical articles here written by doctors on seeing these 9/11 workers and assessing, what happened to them and how well they did on this program. Because while 9/11 was a real tragedy for the immediate victims, what a lot of people don't realize is that it's really been misery for the delayed victims. In fact, there's more than 1 million people that live and work in the lower Manhattan area immediately around 9/11, within a mile or two of where the World Trade Center stood. So these are your delayed victims, but specifically in this program, the rescue workers who are right there on site and for days and weeks, and in some cases for months. they were exposed to asbestos, radioactive substances, benzene, dioxins. Dioxin is a degeneration product of plastics. It's used in plastic production, but it's also given off when plastics are incinerated. Fiberglass, mercury, lead, silicon, manganese, sulfuric acid, and pulverized cement. So a lot of you have seen the pictures from 9/11. You can imagine what they were exposed to there. Very, very common among the 9/11 workers is breathing problems. In fact, they named the breathing problem the World Trade Center cough. And this was, in later years, found to be due to pulverized cement in their lungs. Asthma, bronchitis, emphysema in smokers and non-smokers. Asbestosis, mesothelioma, which is a peculiar type of lung cancer that is caused specifically by asbestos. Silicosis, berylliosis, all these metals and fibers that composed the millions of offices in the World Trade Center. When it went up in flames, it was like being in the world's largest plastics plant fire. The rescue workers very commonly suffered from chronic sinus infection, from gastroesophageal reflux, a variety of skin conditions, diseases or tumors or actual cancers to the kidneys, liver, and throat, sarcoidosis, which is a disease really of unknown cause where there's tremendous inflammation in the lungs, and even leukemias. And what they commonly also experienced is what is now being characterized as a toxic encephalopathy. That simply means a toxic brain disorder. And although this has been commonly diagnosed as post-traumatic stress disorder, that's just sort of a wastebasket diagnosis for a collection of mental symptoms, including depression, anger, low motivation, no energy. Many of these rescue workers could not get back to work and ended up filing for disability, went on early retirement, and really had some profound personality changes. There is a study that's been done on about 400 of the World Trade Center workers who went through the New York Detox program, and the results are really, really remarkable. And this slide shows their own scores for their self-rated improvement in quality of life regarding health. Their improvement in their health-related quality of life. And the first bar there talks about what the blue bar is what their score was, how they rated themselves in terms of poor health before the program, and the lower purple bar is how they rated themselves after the program, just in terms of poor health. The second set of bars is how they felt mentally. How bad their scores were. So you see very high scores before the program, and after the program the average score was much lower in terms of their own rating of their mental health. Limited activity. A lot of scores, people themselves felt like their activity was limited, and in terms of activity, that's where we saw the greatest improvement from the sauna detox program. They no longer had limited activity afterward. And then that was also reflected in the last set of bars there, which is the days of missed work were definitely less. Now, like I said, some of these people had already taken early retirement, so they really couldn't quantify the days of missed work. This slide looks at their own self-rated severity of symptoms after the detoxification and before the detoxification. So again, you could see here their symptoms of the skin is the first bar, before and after. Cardiac symptoms definitely reduced, but respiratory symptoms was where we had some of the greatest improvements. Ear, nose, and throat symptoms. So we see the sinusitis, the runny nose, the bloody nose is dramatically decreased. Neurologic symptoms, another one of the biggest results here in terms of actual neurologic symptoms. This could be anything from tremors, numbness, tingling, various types of pain. Different from the next bar, which is their emotional symptoms, how they rated themselves in terms of their change in personality, how short their fuse was, how irritable they were, how fatigued they were, how much energy they had. The next one is the cognitive rating, how fast they were, how good their memory was, how engaged and interested they were. The next one is their gastrointestinal symptoms. So like I mentioned, a lot of people had reflux, and that really got decreased quite a bit with the detox. A lot of musculoskeletal symptoms among the World Trade Center workers, and that was another one along with the respiratory that went down quite dramatically, joint aches and pains. And then immunological, and this is their own rating of how frequently they were getting colds, the flu, various infections, how well they could shake off a cold. This next pie charts show the change in the use of medications, and this was quite remarkable. I have visited the New York Detox Center, and they actually have on display there huge gallon-size Ziploc bags full of inhalers. And I said, wow, these are all the inhalers you collected from the participants? And they said, no, this is the inhalers that one person was on before the detox, on nothing afterward. And so you could see here the number of medications that people were on before the detox compared to after the detox. And what we found is that 84% of those clients requiring medications to manage their symptoms before the detox were able to discontinue their use. 84% stopped their medications. This is really remarkable. I don't know of any medical program that's got results like this, that has statistics like this. In fact, these World Trade Center workers are being followed very closely by Mount Sinai health system up in New York City, and you know, basically are given prescriptions for their various symptoms, whether it's depression or respiratory problems or fatigue. They're basically just given medication for it. But this program was actually showing an 84% of the clients reduced their medications. Actually were able to discontinue their medications, an even more remarkable statistic. And chief among those discontinuation of medications was the inhalers for breathing problems. And here we see a change in a balance test. A balance test is a good indicator of nerve and brain toxicity from environmental toxins. And it's a very easy test to do that doesn't require you know, any blood work or anything. And we tested it balanced in two ways, with the eyes open and with the eyes closed. And you're really relying on you know, many more internal neurologic mechanisms to maintain your balance with your eyes closed than you are with eyes open. And you could see here the before and after in the balance test with eyes open and eyes closed. There was also, not shown in this slide, there was also a statistically significant improvement in reaction time when they were making choices between two things, timing how many seconds or fractions of a second that took. And also there were significant increases in the IQ before and after, an improvement in cognitive function. This is another test. This is the change in reaction time. The bars on the left is their mean reaction time, just simple reactions, and on the right is their difference in reaction time when they were given a choice of what move to take, what decision to make. So these look small here, but I could just tell you on the numbers they were statistically significant. So let's take a look at that's a very large study of over 400 people who went through the World Trade Center detox. Like I said, there's nearly 1,000 through that program now, and updated studies are being done, but there are some more human studies regarding this specific program. One at the top there was, or on this slide, is a study of people in Michigan who were accidentally eating contaminated beef. And apparently in a whole set of feed cattle, there was accidentally put in their feedlots some pesticides right into their feed. And this was distributed in the community. So these people broadly were exposed to contaminated beef and actually ingested pesticides. And what they did in these people, they actually did measure their fat levels of toxins, specifically for the pesticides that they knew had been in the feed. And they could find 16 different toxins or toxic metabolites in the fat biopsies of these individuals. So they put them through this exact sauna detox program. And after detox, they found that 13 out of 16 toxins had reduced across the board in all the participants. But the amazing thing is that 4 months later, all 16 toxins decreased. So this tells us that long after the program, the body continues to detoxify. So this is really remarkable, and there's not that many detox programs out there, I could tell you, that can show this kind of statistic. Another human study looked at various people who had various exposures. It was just sort of a mix to various environmental drugs or medical toxins. And what was found is that their blood pressures tended to reduce into a normal range if they were high to start with, that they commonly had lowered cholesterol, improved test scores on psychological testing, and improved IQ. And that's just shows you how toxic these environmental poisons can be to the neurologic system. Another group who's benefited from the sauna detox is the Utah Meth Cops Project. And this this sauna detox was offered to narcotics officers whose job it was to bust the amphetamine labs. Now, often, apparently, what the people operating the labs do when they know that the law is on their tail is they'll incinerate their labs. So they set it on fire, they're out the back door, the cops come in the front door, or whenever they arrive on the scene, and they're not only exposed to all the toxic chemicals that are just sitting there in the lab, but now they're exposed to them in a fire. So the fumes, the dust, the smoke, and the volatile chemicals that are now airborne and getting on their skin, on their clothes, and that they're directly inhaling and even touching. So there have been scores of methamphetamine cops that have gone through this with tremendous benefit, and some of them were even retired. This program is strongly endorsed by the Utah Attorney General. It's also endorsed by their commissioner of their Department of Public Safety and by a state trustee from the Fraternal Order of Police, as well as countless participants, including various chiefs of police and sheriff's departments that have actually gone through the program. One of the things that participants can experience going through the program is a mild drug-like sensation or toxin-like sensation. So let's say that they had their exposure 20 years ago or 5 years ago, and they haven't really noticed anything having to do with that since then, except that today they generally don't feel well. But when they're going through the sauna detox, it's not uncommon that while they're in the sauna, they'll sort of experience that drug or toxin again, whether it's a taste in the mouth, or whether it's something showing up on the skin, for instance. If they may have had a spill of some toxin onto their skin, they may see that area turn red, or it'll get prickly or tingly. It's not uncommon that people who have had dental procedures with Novocaine will actually taste the Novocaine transiently. It could last a few minutes. Some people who have done street drugs will have a mild drug-like sort of mental sensation for 20 minutes or so while that is being mobilized, is what we presume is happening there. There can also be just periods of fogginess. Of course, one thing that identifies a poison is it can cause unconsciousness and even progress to coma and death. So there can be periods of fogginess that people go through without really knowing, okay, well, what toxin was that from? But then it passes. One remarkable thing about the use of niacin, not seen with any other detoxification program, is that old sunburn patterns, in other words, the exact pattern of where your bathing suit was, will turn on and turn off during the sauna detox. I know that one person who had this detox done, who had worn sandals one day and had a tremendous sunburn that day, and it left the pattern of the sandal on the top of her foot for about a week until that sunburn resolved. And that had been when this individual was a teenager, and this person was now 40 years old going through the sauna detox. And that exact pattern of their sandals, showed up on their feet for about 10 minutes in the sauna detox, as well as their exact pattern of the bathing suit they had on. So this is why niacin is thought to really handle the toxicity from radiation, unlike any other substance that we have. Now, regarding toxins coming out, there is a report that in the Utah Meth Cops project, actually amphetamines were detected in the urine of the cops going through the detox. Now, the common medical understanding is that amphetamines are water soluble and that they're completely gone within a maximum of 4 days after you've ingested them and cannot be detected in the urine. But then when, provoked by a detox program to be released from the fat, we were seeing this come out in the urine. That's quite remarkable. The other thing that can happen is people can experience transient periods of emotionality that may be connected to whatever was happening at the time that they had the detox. At the time that they had the toxic exposure. So again, this gives us an indication that stuff is coming out that's been there for a long time past. Now, the real keys to successful completion of this program are very, very close and, in fact, stringent supervision. Very close supervision. A person is not left to do this on their own. Like I said, a person can just go to the store and buy Clear Body, Clear Mind book and can read about it and can certainly jump in a sauna. They're very unlikely to have a full benefit from the full detoxification program without very, very close supervision. Part of the reason is when the going gets tough, people tend to bail out. And when you have a supervision with somebody, you're more likely to kind of stick through the difficult periods of this and to make it through. The other thing that's very, very important about this program is the gradient approach. And this is all guided by the dose of niacin. So as the duration of the sauna is going up, the dose of niacin and the supportive vitamins, minerals, and oils are also going up. And it's stepped up in a very, very specific way that's individual person to person. So this is a very specific formula, but it's individualized for each participant. Now, lest you think that anywhere from 2.5 to 5 hours in a sauna is going to kill you, let me give you this quote here. "No one has ever drowned in sweat." That's a quote from the very successful former Notre Dame coach. Now, some people are really just sort of feeling like they're just sort of stuck with aging, with getting older, and the bones don't work as well. You don't jump out of bed as energetically. You don't get as much out of your exercise program. But the fact is that you can feel better. We're exposed to just everyday exposures in traffic, in the foods that we eat, in the air. There's various hazardous occupations. Some people have toxic hobbies, like we mentioned the other day, the guy who built some 50 kayaks. Some people are really experiencing the cumulative effects of drugs that are still residing in their bodies. It's actually been found that you could do fat biopsies and find crystals of PCP and LSD residing in the fat from a single time exposure decades earlier. Of course, hormone interruption is a big concern of mine as a physician because we see so many hormone-related cancers these days. Residual effects from anesthesia. It's one of the most significant things that people get detoxified from in this sauna detox program. So if you've ever had surgery with general or local anesthesia, you will experience a detox from it in this program. Reducing your cancer risk. It can be done, especially since, as we see from the President's Cancer Panel report, that environmental cancers are a direct cause of much of what we're seeing today with the cancer rate. And we also see people benefiting tremendously from the sauna detox who have undergone cancer chemotherapy and radiation, and they're trying to recover from that. Now, why detox instead of just taking a pill for your symptoms? Well, the fact is that this is an entirely natural way to recover, to rejuvenate, and to reduce your future risks. And if you're like this fellow here who has a little bit of distrust for modern medicine, you've got a lot of company, and there is a place to turn for a more natural approach. Why detox? Some people detoxify because of just chronic body problems, just in general pain. Maybe they have a diagnosis of arthritis, maybe they don't. Maybe they have sort of chronic bowel problems. Maybe they have chronic low-level allergies or overt asthma. Sometimes they just are suffering from chronically poor sleep. It snuck up on them over the years, and they find themselves having a hard time falling asleep, and then they awaken at 3 or 4 in the morning, and that's it, and then they're extremely tired in the morning. General mental fogginess, decreased reaction time, like I said, not getting as much as you used to get out of exercise, a low energy or a general lack of vitality. Some people who get their hormones adjusted, but they're still not feeling well. That's especially common with people who get their thyroid treated, but they still have all the symptoms of low thyroid. Obviously, they need to make sure that their iodine level gets corrected, but there can also be just an underlying toxicity because the thyroid gland is very, very sensitive to environmental toxins. And all a conventional medicine does is, give you some thyroid supplement. They really don't get at what's the underlying cause there, whereas this detox program, we find that people who are on thyroid medicine suddenly respond to it much, much better than they did before the program. One common thing we see is that people just don't have the interest or enthusiasm they used to have for their job, for their marriage, for their life, and that once they go through the program, that totally turns around. So here's how you get started on the sauna detox as administered by Sonapeer. Is number one is the health inventory, and that's basically taking a look at what your symptoms are and what you're trying to handle. The second one is a toxic exposure interview, and part one of this webinar, which you can access through the archives and Building Strength webinars, really went into what a full toxic exposure interview is. The President's Cancer Panel report, the number one recommendation from it in April of this year was that all physicians should be doing a thorough toxic exposure history on every single patient on a regular basis. Well, the fact is most physicians are not educated in this and don't have the first clue about asking you how to get a toxic exposure history and how to get you to take a look at all the various things that you could have been exposed throughout your life. But we do a thorough toxic exposure interview so that we can get an estimate of your toxic body burden. And finally, there's a physical exam and laboratory test to make sure that you're in the best shape in order to go on this program. We don't want you starting this program if you already have a vitamin deficiency or if you've got some medical thing that needs to be addressed. We want you to really be in good shape so that you can actually start the program, and there are some criteria for that. You can click on the link that's in the upper right-hand corner of your webinar page there on the title, Cancer and Toxins, How Toxic Are You? Oops, that's the title of the first presentation. Anyway, you can click on that link up there and it will take you to Austin Detox and will give you more information about this program, or you can go to my website. And I actually have, I want to take a look at the time here. We have a little bit more time. I'm going to go into some case studies, if that's all right, on people that actually went through this program. Now, this is a case study that I did share with you back on Tuesday in the webinar on cancer and toxins, but in case you didn't see it, this was a really great example. This is a person who's only 39 years old and is currently a fitness trainer, but she just doesn't feel like she's at the optimum health she could be at, and she's also a Gulf War veteran. Now, one of the comments that I got from the webinar on Tuesday was that, oh my God, those cases you presented, those people sound like they're a total wreck. Well, these are normal, everyday people walking around, doing their jobs, having their family, trying to enjoy life. I mean, they don't look obviously like wrecks, but when you get into their toxic exposure history, it is a little sobering. This particular person had chronic pain from an auto accident, was suffering from migraines, was taking pain medications and muscle relaxants, had 29 chronic everyday symptoms, and 19 of them were rated at least moderate or severe. And the biggest problems were concentration, memory, and headaches. And so we found that this person had been in the military, had multiple exposures there, had worked at a nail salon, worked in metal fabrication, did some auto repair, worked janitorial, and had been a waitress, had some exposures there, had some exposures in a paper mill, did some house painting, involved in some woodworking, jewelry making, had spent time growing up in mobile homes, and had quite a exposure to various firearms. So listed on the right side of the slide there is all the various toxins that this could have probably exposed this person to based on these exposures. She was also exposed to multiple metals based on eating tuna every single day as part of a health regimen, having played with mercury from broken bulbs or thermometers, or at least been exposed to it, having a time period where a bunch of mercury amalgams were removed. Of course, mercury is a preservative in vaccines, being exposed to various paints and fuels, and being involved in car repair. All those things can give you the various metal exposures. Metal exposures in this individual probably also came from living in a house that had old plumbing, from depending on well water for a number of years, from being exposed to treated lumber, living near a landfill. Also, she had extensive body art, and the tattoo dyes and pigments are known to contain lots of metals, had worked with explosives and anti-tank weapons. Sorry, that's a duplicate slide. She was also exposed to fumes from new carpet insulation, household cleaners, workplace pesticides, various other exposures there. Secondhand smoke, lived near a high voltage line for 1 year, had multiple operations, had titanium implant in her knees. And this is just a urine test that was done on her from US Biotech, which looks at the degeneration products of some of these plastics and petrochemicals in this particular individual. And you could see in the red how high some of these metabolites were in her urine. Now, this, like I said, is a very indirect indicator of what's really going on in her fat, but at least we know she's got, levels that are well beyond what we would see in the average population. So, what we see in detox results. Now, I have to say this person here is also 39 years old, but that's not the individual whose case I just gave you. In fact, I believe that individual is still going through the detox today. Just started a couple weeks ago. This is some results that I took from various detoxification participants that I'm familiar with. This was a 39-year-old who was involved in the 9/11 cleanup, who had the World Trade Center cough, which, as I said, was found to be due to pulverized cement. The cough was gone after the detox, did not use inhalers anymore, said that they had a real return of their energy, were sleeping better, the depression they had been suffering with had lifted, and most remarkably regained his purpose in life and thinking cleared up. This is a 42-year-old who underwent the detox after cancer chemotherapy, and the chemotherapy left this individual with a very painful neuropathy. So not only was the nerve inflammation gone, but the joint pain disappeared, memory returned, there was no more chemo fog. Chemotherapy is toxic to cells, including brain cells, and there's a common thing called chemo brain, and this leaves a person with sort of a fog, and the person was completely free of that chemo fog after the detox and felt a return of energy, sleeping better, and an anxiety that they had resolved. This is a 17-year-old, really touching story actually, who is a former prescription drug abuser. And she said that she felt clean again after the detox, and in her own words, became my bright self again. And said that there's something to live for, and said that it was much easier to get active and involved where she had kind of withdrawn when she was going through her drug use period. And most remarkably for her, she suddenly became a good student for the first time in her life. As you saw, the World Trade Center results, the IQ increases after this program. This is a 31-year-old who had had several major operations involving general anesthesia for prolonged periods, and their depression lifted. They had no more chronic pain. Again, they say they came out of a fog that they didn't even realize quite that they were in until they saw the difference after the detox. Feeling hopeful about life again. Their sense of taste returned. This is one thing that just mysteriously had been really dampened and completely gone for certain tastes after all these surgeries. Felt a resurgence of energy, their vision improved, and their skin cleared up. By the way, the skin clearing up is one very common thing. Almost everybody says that as a main thing that happens. This is a 58-year-old dentist who recently completed the program. Skin improvement, more energy, sleeping better, no more anxiety, joint pain improved, quote, now I can exercise. And this is one common thing that we see in the detox is people feel that now they can get into a vigorous exercise and fitness program. A new interest in life and mental clarity, which is really needed for her job as a dentist. So again, these are some resources for you, or you can click at the upper right little thing there on the webinar web page, and you can go right to the detox website. And at this time, I'm going to go ahead and answer some of the questions that have been coming in, okay? Let's see here. Can these two symptoms be corrected by your detox program? Let's see. Let's see, what are the symptoms they're talking about? Maybe somebody can submit that question again because I don't see the symptoms there. But I do want to say, I get asked that question a lot. Will my psoriasis really be resolved? Will my Parkinson's go away? Will this cure my asthma? And what I say is that to the extent that your symptoms are being caused or contributed to by toxins in your fat, this program will alleviate or resolve them. So that's rather qualified. It's not strictly speaking a medical program, but any clients that I put through this program, I'm right on the line. There's always a resource to a doctor in people going through this program. I have just seen really, really remarkable improvements. It's actually illegal in some states, for instance in the state of New York, to actually claim a cure for anything. Believe it or not, even Mount Sinai can't claim cures. It's illegal. It's against their Medical Practice Act to claim a cure. Having said that, I could just tell you that I have seen some really remarkable things with this. From anything from asthma to depression, psoriasis, as I mentioned, Parkinson's, tremors, mental clarity, joint pains, all kinds of things. But like I said, to the degree that your symptoms or your condition is caused by or contributed to by toxins residing in the fat, that's the degree to which this program will handle it. And of course, a lot of that we cannot tell in advance. Another question, does vitamin B3 interact with the drug Coumadin? We have had people on Coumadin on this program, and they have done very, very well. It's not a direct contraindication to the program. We do know that niacin does affect some of the clotting factors as Coumadin does. What you can do is always, people who are on Coumadin, which is a blood thinner, can just check their levels more frequently, what's called their PT, their pro time, to see just how thin their blood is. But in cases where we've actually done that, we have not found that it affects the PT, the prothrombin time. And it is a safe program to do while you're on Coumadin as long as you do have medical supervision. Is it true that sauna is unsafe for persons? Let's see here. What's happening is in these questions, I'm only seeing the first line of some of the questions. So on that one, I'm not sure what the whole question was going to be. Yeah, I'm only seeing the first line of many of the questions. In my opinion, is it worth drinking city? I'm presuming it's city water versus well water. Any water source should be tested. You can get your own water source tested. There's all kinds of kits you can get through the internet. There's all kinds of services that will check your water, whether it's city water or well water. There's good well water and there's bad well water. So you've just really got to find out what it is you've got there. And one of the most effective ways to handle your water is to attach a reverse osmosis system to your household water system, at least to the drinking part of your water. It's not that crucial for other water, although in some city systems the water is so heavily chlorinated and fluorinated that you're going to want to have the filtering system also in your shower water. But certainly you can get your water tested, and the quality of the water just varies. I'm sorry, some of these questions are only coming across as the first line. Can the air in a previous marijuana co-op Okay, I think they're asking about secondhand smoke from marijuana. Yes, you can get exposures to marijuana from just it being in the air, absolutely. Is edema due to fluid retention in the lower legs? Sorry, I don't see the rest of the question. We do see, in some situations, we do see chronic swelling problems resolved with the use of this program. One thing I want to say is that we keep a very strict watch on your weight. You're weighed at the beginning and the end of the detox day every single day, and the weight is recorded. You actually fill out a form of how you're feeling every single day. And we do not let people lose weight on this program because weight shifts are usually an indication of some fluid imbalance. And so we don't like to have this combined with a weight loss program, but we will often see chronic swelling problems resolve. Let's see here. How can we find someone who's doing this? There's some resources right there, and the current slide that's on also has my email address. There are other people doing this around the country, and if you're not listening here in Austin, Texas, then you can go ahead and email me, and we can give you some resources about where this is done in the rest of the country. Let's see if I handled all the questions here. Average length of this programs. The average length is anywhere from 2 to 4 weeks. It's unusual for the program to take less than 2 weeks. And it's not a direct relationship to the actual amount of exposures that a person has had, but we do find that the more exposures, you can expect it to go a little longer, but it's not an exact relationship. What we find is that if people are, if we make sure that there's not any kind of anemia or obvious vitamin deficiencies before they go into the program, that they have a very smooth time on the program and do very well with it. So 2 to 4 weeks would be the average length of this program, and it can vary. Cancer chemotherapy, general anesthesia, these are two things in particular that might take a little bit longer than some other things, depending on how much exposure was there and how many episodes of toxic exposure there was. Can hypertension patients use the saunas? Yes, they can. We don't like anybody to go into the sauna with uncontrolled blood pressure, obviously. They're going to be going on a treadmill for 20-30 minutes a day. I mean, it's not a good idea at all to walk around with uncontrolled blood pressure. And so we like to have the blood pressure in a good range before you start the program, but people on blood pressure medications, definitely can do the program. We've had people on all sorts of medications do it. Now, there are some medications that are going to block the niacin, that are going to prevent the niacin from working. So these particular classes of medications, we work with you and your doctor to see if you can substitute them or be off of them for a while, but those are usually optional medications. They're usually not medications that people actually need for specific diseases. Then there's a question, the question on the water was city water versus bottled water, which is worse? Well, we're now finding out that these plastic bottles that we were told were just really wonderful all these years and perfectly safe maybe are not so safe because of phthalates and bisphenol A. Both of those plastic products can off-gas into the water from the water getting the bottle getting cold or very hot, and so they're not as safe as we thought. So bottled water comes in all different qualities. Some of it is just filtered municipal water. Others is, for instance, the Evian water that has a very high content of beneficial minerals in it. There was one time period several years ago where Evian water was also found to have some accidental benzene in it, and it was actually coming from a natural source from the ground, and of course benzene is a cancer-causing chemical. So the quality of the water in bottles can be just as variable as anything. So again, know your water, know where it's coming from, and in this day and age, not a good idea to regularly drink out of plastic bottles. Do you do this every day? The sauna program is a 7-day-a-week program for 2 to 4 weeks until you, on your individual program, are complete on it. And it's a very individual endpoint for each person. And so yes, it is every single day, and that's one of the strengths of the program. As I pointed out on the one slide about the gradient approach, you're increasing the niacin on a regular basis, and an interruption in the program, even of a day, can set you back. So really a person has to sort of clear their schedule and dedicate themselves to this program. And some people do it, after work at the end of the day. Other people just sort of work half days while they're doing this. Other people just treat it as a little spa experience. But you do it every single day until it's done. Absolutely. The average total cost, I personally refer people for this program and am a medical liaison for it. I don't personally run the program myself. Like I said, it's very, very stringently supervised. There's a person who's totally in charge of it, and there's another person who's supervising each person who's going through it as a case supervisor. And you can click on that link in the upper right hand corner, and there's contact information there at Austin Detox, and you can get more information about how much this costs. Let's see if we have any other questions here. Do people have to go off their medications while they're in the sauna? If they're taking an essential medication for seizures, for diabetes, for high blood pressure, absolutely not. But if they're on a drug that's going to interfere with the niacin, yes, we would work with them and their doctor to make sure that they can safely go off of that for the duration of the program. It's very interesting. One of the things that can sometimes interfere with the detox is inhalers, partly because it's continuing to give you toxins. Most inhalers for asthma and breathing problems are actually delivered as fluoride salts. Well, fluoride is a toxin, so it just doesn't make sense to continue to suck on your toxin while you're going through the detox. So we've had a great success in having people stop their inhalers and only use them on a rescue basis when they need it instead of every day as they're going through the program. And a great deal of those people, particularly in the World Trade Center situation, were able to not have to go back on their inhalers at all. We're not going to take somebody's inhaler away if they actually need it in order to breathe normal on a daily basis. They can still get through the program. They get faster and better results if they're off their inhaler while they're going through the program. Let's see if I missed any of the questions. Okay, I think that's, let's see, one more question here. Yes, you can go ahead and email me if you want to know where this program is being offered aside from Austin. And it looks like that's all the questions here. Oh, does this program leave you energized or wiped out? There can be periods where you're feeling the stress of the program, but usually that's a time period when we need to adjust your water intake, adjust your minerals perhaps, make sure that you're eating adequate protein, keep up with what your sleep is. So the difficulties in the program are usually only encountered if the person kind of veers off the exact recommendations. So it should not leave you feeling wiped out if you're strictly adhering to the copious water intake. And part of the program is to actually supply you with your exact doses of vitamins, minerals, oils, calcium, magnesium, and niacin. All this is supplied to you through the program, and just to really keep an eye on your weights before and after each day, and also on your water intake. So it should not leave you, completely drained if you're really adhering to the program exactly. Like I said, some people go to work and are doing this as an evening program. Let's see here. Okay. See if there's any more questions. There's a question about autism spectrum kids. Autistic kids and kids with various mental problems, whatever they're calling it these days, it seems like autism is the popular thing, have gone through this. I don't know of any actual studies that shows us statistics of results. And again, with that, I would say to the extent that toxins that are still there residing in the fat are contributing to the behavior and mental problems, that's the extent to which we would expect this program to benefit them. On the other hand, one of the theories is that these autistic kids actually are affected this way since birth, and so we could be dealing with some abnormalities that it's too late to get at. Similar with other neurologic disorders, even though we do see good improvement in neurologic function in many people who had symptoms beforehand, for instance with Parkinson's disease, there may already be so much gone on already with the brain that by the time we get to the program, perhaps at that time, what we could do is slow down or arrest the progressive nature of the degeneration rather than reverse the situation altogether. Certainly this program is probably got its greatest benefit in preventing the future development of disease, and the extent to which it's handling current conditions, again, is dependent on, are those toxins that cause the thing still there to get out of the fat. See if there's more questions. Let's see, I think I've handled most of these questions here. Okay, does it help with diabetes or heart disease? We definitely know that niacin, just independently of a sauna detox program, has tremendously beneficial effects on hardening of the arteries and reducing blood clots and reducing cholesterol. The current theory, especially among anti-aging and regenerative medicine doctors, are that both heart disease and diabetes are actually inflammatory conditions and are very, very much toxin related. There are also two conditions that are prone to occur when somebody's exposed to hormone interrupters. We do feel that the sauna detox is at least going to impact future risk of those diseases, and I have personally seen in my patients, although it's not statistics that I could publish in the medical literature at this point, people having improved control and even able to come off medications. So again, we're not putting this out as a cure-all or anything like that, but to the extent that the inflammatory underlying condition that contributes to diabetes and heart disease is caused by toxins that we're getting rid of in the program, yes, we would expect to see some benefit there. What is the range of dosages of B3? The niacin goes anywhere from a starting dose of 50 to 100 milligrams, and 50 milligrams, for instance, is what you might see in a super B complex, all the way up to a maximum of 5,000 milligrams. Now, if somebody went out and tried to take 5,000 milligrams right now today, they would probably just faint away. They would get a massive flushing reaction. Their blood pressure would go down. They might even throw up. It's increased on a very, very gradual level, and there's certain things that the sauna supervisor is looking for in order to decide whether or not, and when to go up and at what rate to go up on the niacin. So the gradual increase is what allows the person to tolerate the higher doses. And like I said, we're also gradiently increasing the supportive vitamin and minerals and oils all the way along the way, and that's the only way that these higher doses of niacin are actually tolerated. One question here is a real excellent question: how often should we detox? Well, I can tell you that I last did this program in 1996. I've had several dental procedures since then. I've had to take some medications, and I've had various environmental exposures, including to the plastic bottles we've all been drinking out of. And I'm ready to do the detox program again. So how often should we detox? An excellent question, but just like our ability to exactly assess the toxic body burden is quite limited, we really can't, we don't have a cookbook formula as to how often you should detox. If you want to reduce your risks, if you want to reverse some degenerative things that you're seeing, if you want to get some improvement in some chronic conditions, if you just think that you could feel better and want more vitality, I would suggest doing this program. And if you got a lot of benefit from it, do it again when you're ready to do it. What we do find is people who do it second time around typically have a shorter program to go through. Okay.